Well, good evening, everyone. This is Dr. Ellithorpe. I'm with Tustin Longevity Center here in Southern California, and we meet every Tuesday night at 6 o'clock to 7 o'clock, and we try to address the functional medicine or integrative, complementary, alternative medicines approach in medical doctors who have a standard allopathic medical degree, but those of us who have decades and decades worth of experience in this, our perspective and how we look at the development of treatments and the burst of enthusiasm we're seeing in looking into finally lifestyle changes, nutraceuticals, and recognizing the research and the work of so many wonderful doctors who we all stand on their shoulders. So we do this every week, and I will try and give you my best impression of how I would look to approach a symptom complex or scenario that you present. But again, this is for educational purposes. This is not meant to be personal medical advice. Again, always consult with your doctor. If you are one of our patients, please make an appointment to address your questions with us in person, or send us a phone call so that we can call you back personally. But we meet every Tuesday at 6 to 7 o'clock. We have a lot of fun. We have two ways of doing it. You can get onto our email list by getting a hold of us at tlcdoctors.com, tlcdoctors.com. And another way is if you're on YouTube and you sign in to our live notification, which you'll get notified if you're on the tlcdoctors.com. We'll send you a notification that this is up and coming. So you can see a link there and you can type in your question. And when you're here in YouTube, you can go into the chat and give us some questions. I will do my best to give you my answer, but as a general practitioner, I am not a specialist. But having practiced medicine full time for 45 years now, and with my father in food research at Armor Food Research, working with the scientific team there, I have at least 65 years of experience and knowledge in this whole war compendium on the natural approach versus the allopathic versus the alternative. And so I'll just give you my impression. And that's what we try and do, is just give this time to you to see how I think, what we think here. There's myself and Dr. Mitchell and PA Lamb and PA Gonzalez. Us four are here to try and do our best to serve you. We also do some health coaching. Our nurse, Terry Delia, is extremely good at working with patients, looking at their lifestyles, sitting with couples or moms who are trying to organize a food plan around the logic of a healthy lifestyle. Not everyone's the same. Not everyone gets the exact same advice, but there's general themes, such as we have an standard American diet that is a sad diet, that is just so full of sugars and high fructose corn syrup that it is harming our immune system, things like this. So the general theme will be to back off on things. So that's where you'll see some similarities. So what I do is we'll go over these, but I usually start with my live questions for those of you who are sitting, waiting, and watching this live and typing in questions. I'll try and get them all done. If this is a benefit to you, if you like having an opportunity to shoot me a question or a scenario and what my gut response is, I'll tell you if I don't know, or take a note down and try and look it up for next week's talk. Then please please subscribe, please help share this, and see if we can find ways to help other people with this just free general approach to helping our patients and our families and friends. Okay, so let's see, what's the first question here? I can see my sister Debbie has shown up. Hi, Deborah. I have to defer. Jennifer, I'm going to jump to my sister. Okay, so Deborah, hi, sister. Could you explain what eosinophilic esophagitis is and why it occurs and how it can be helped? Thank you and love you. Yeah, I know why you're asking that, and I did talk with your son, and I talked to him about his diagnosis, needing to find out his blood type. Um, the lining again of the from the mouth and mucosal surfaces all the way down to your anus is a tube about 40 feet long, and it at different patches has different jobs, like uh, and these jobs are to help take food in, protect us from bacteria, fungus, viruses, toxins, poisons. And so God has us secreting saliva that has immunoglobulin A, which is a generalized, universal, very good protective immunoglobulin. As you swallow it down in the esophagus to the stomach, very often we can get injuries to the lining because this membrane is only one cell thick, one membrane. And I keep on wanting to show you that this membrane here can be injured, and you want to heal it after when you go to bed at night. And when you heal these scratches or irritation all the way down through your gastrointestinal system. We've been teaching this here for 25 years, and I've been involved in teaching this probably for 40 years, 35 years. That scratch will break the barrier between the outside world where food's going down and the inside of your body and your immune system. We live in a marketing world, and in this marketing world and convenience and pleasure, we tend to be marketed to eat things over and over again, and they market them to taste better and better and more addictively. They have scientific research teams. That's what my dad was involved with, the scientific team on armor food research, to get people to eat TV dinners in the 1950s and to hydrogenate the fats so that the rancidity of the oxidation or burning of the fat combining with oxygen with long-term uh, storage of the frozen TV dinners wouldn't give them a bad taste. So all this research goes into you repetitiously eating food over and over and over by pattern, by pattern, by pattern. That pattern then generates the ability for you to higher likelihood have that kind of a food base leak into your body through the lymphatic, through the membrane injuries. And so your body's immune system will be triggered. So in eosinophilia esophagitis, that is where the esophagus in Matt has become inflamed, irritated, and the immune system, in particular the eosinophils of the branch of the blood leukocytes or white blood cells. There's different branches of them: macrophages, mast cells, lymphocytes, killer cells, and eosinophils. These cells then are typically associated with allergies. It could be associated with parasite infections. We are seeing higher and higher eosinophilia percentages on CBCs than I ever saw before 45 years ago, 40, 35 years ago. I'm seeing more and more people have triggered their allergic reactions to foods more and more. Now, so we teach patients that they should find out their blood type, because the first usual group of people that gets eosinophilia esophagitis are blood type A people. And that's because they don't digest their food as well from their childhood on. And with partially digested foods, not enough stomach acids, not enough digestive enzymes, day by day, meal after tens of hundreds of thousands of meals with repeat marketed foods, there's going to be an assault on the lining of the esophagus, and there'll be heartburn, bloating symptoms, maybe motility issues from inflammation from the foods. And this irritation then usually brings people to their doctors by their 20s or 30s. If they drink alcohol and smoke, it'll accelerate the inflammation and damage. And then eventually they'll wind up getting a endoscopy from the gastroenterologist, and then they'll see this redness or erythema, and they'll take little biopsies they'll look at it and then they'll see all the eosinophils. These are what lead to it. But it's only just now, and I'm so thankful to God to see that doctors are starting to open up and listen to us old integrative, alternative, functional doctors that have been holding the line all these decades over and over, no matter what kind of insults or disparaging remarks they make about us, having our patients use special diets or having expensive urine. They now realize we were on the right track all the time. And for that, I give glory to God and to all the wonderful doctors who have come before us to tell us to put the patient and their story first, and then for us to go home and do some homework and think about it. Now we see Dr. I had trouble with her name last week, Hassan, Hasan. She's a gastroenterologist up in Ventura, and she's starting to do research now and found, for instance, the association between the SARS-CoV-2 virus infection and the lack of bifido good bacteria in the stomach, and that those who didn't get the illness or any significant problem had better gut bacteria. Not that we know everything about gut bacteria, but at least we doctors decades ago humbled ourselves to try and look into the poop and get our fingers, so to say, in the poop and culturing it and studying it and looking at it. And we started to see these families of microbiome. So we know that helps us with making vitamins and other nutrients and neurotransmitters for our happiness and our well-being. So the whole microbiome is an entire community of trillions of cells, thousands of families and phyla. And so nobody really wanted to address it because it's hard to start a big puzzle. I was just putting a puzzle together with my little 3-year-old grandson, and I got the big puzzle pieces, and I even had trouble with the big pieces. So, trying to look at poop with thousands of phylum is challenge. And I bring that up because we tell our patients to eat a carnivore diet in general because it's the most healing, uh, anti-inflammatory diet there is. Now, a lot of people resist that, but we have found over the decades that for a short time, maybe 2-3 months at least, if they are a pure carnivore, finding out their blood type, if they're a blood type A, or if they're older, say 50, 55, 60, your digestion is not as good as the average person. So we have them take digestive enzyme with their meals, not before, with or after, shortly after they're eating. We have them take probiotics to try and help that gut flora. We try and tell them to stop eating the latest 5 o'clock if they're younger. If they're older, we try and say 4 or 3 o'clock, so that stomach has time to get that digestive enzyme, chew up the material, and then that acid will increase, and then the door will open to the duodenum, and the food will go out to the rest of the body. And this process slows down with our age. That's why the older we get, we should not eat so late. So, because this membrane, and hate to be redundant, but everything, this is where all diseases, this picture, that's why I've had it here for 25 years in my office, teaching about phospholipids and the membranes 30, 40 years ago. Okay, so here is this membrane, and it's made of this double layer of phospholipids on the top and bottom. It looks like a sandwich, and these little blobs, round blobs, are representing proteins. So what has protein and fat in it? Well, that's meat, fish, chicken, turkey, beef, eggs primarily, that are mammalian based, that have very accessible, easy to digest and repair the lining of your gut. So if you eat a primarily carnivore diet with digestive enzymes, you're going to have a higher rate and quicker healing. If you don't eat late and you eat this carnivore diet, you'll advance your healing and reduce your inflammation faster. Then we give probiotics. We also have that powdered. See, I keep it here because almost all Americans eat so lousy we all have the same problem. So we keep this on our desk like this to show the let's do it one at a time. They're dropping on me. Okay, so let's do it this way. So phospholipids are those little fats hanging down and up. Okay, so I've pushed to get this for 35 years. I've been pushing for this, and we have it at Orthomolecular. It's fat, so you have to mix it in warm water, and then we mix it with immunoglobulin A. This is the serum bovine immunoglobulin, and it's got some aloe in it and some immunoglobulin G, which is the as well. So we mix this with the fat in a cup of warm water, and then we drink it morning and evening to promote the healing of that injured membrane. And then we start out with a powdered probiotic. You could put all three together in the water, warm water, not hot water. And then what happens is you start healing. You say, I'm healing. I'm not thinking about trying to entertain my mouth or entertain my marketing for pleasure and stuff. I just eat my meat, and then eventually in 2-3 months we'll come off of carnivore and we'll go to eating that with cooked vegetables because raw foods are much harder on the lining of the membrane. And you'll find within 2-3 months you're going to find a great degree of healing, so that when a repeat endoscopy is done, usually the redness is diminished and the eosinophil count comes right down. So we also recommend they take multiminerals. We recommend that they take the antioxidant Juice Plus. We recommend they take the multi B vitamins because all the A-type blood people don't digest the acids, and therefore they don't make intrinsic factor, therefore they don't make the B vitamins as well. So their metabolism for healing needs to be helped with these things. And then we recommend the vitamin D. So with the minerals, the B vitamin, the vitamin D, usually we'll give everyone we know iodine, which is iodoral 12.5 milligrams per tablet, at least one a day. Then we'll give them the digestive enzymes with their food. Then we will give them very often systemic enzymes to assist in bringing down that inflammation on an empty stomach first thing in the morning. And then we give them the powders for about 2-3 months worth of use. And then we see how they are, and we get them retested, and usually they all get better, every single one of them. So that's that, Debbie. And my dear sister, I hope that he's getting better. And let me know. I think he called Uncle John, my husband, and has reordered some of those nutrients. So he probably sees benefit from it. But please don't tell him to worry about giving me a call. I'm his aunt, okay? And I'll happily talk to my nephew and tell Matthew to call me, okay? Let me know how he's doing and when he's going to get a repeat endoscopy or not, okay? All right, Debbie, thank you so much. And before that, we had Jennifer. Jennifer called and says, hi, Dr. E. Hi, back to you, Jennifer. It was nice seeing you in the IV suite the other day. My integrative oncologist knew I couldn't handle heavy aromatase inhibitors, okay, for hormone positive breast cancer, and wants me to use myomin, okay, which is more natural. So this is a natural enzyme that is associated. It's a plant type product, myomin, that assists in breaking down these hormones, okay, preventing them from impacting cell membrane surfaces on your breast tissues, okay, which is fine. Myomin is there, and I believe that's what we also have here, and we provide that, which is of course more natural. Why isn't myomin mentioned more often? Well, it's probably because myomin is not patentable because it is a natural product, a natural plant estrogen blocker, and helps push the breakdown of the estrogen products and away from the cell membrane, since you had an estrogen positive membrane. But mind you, all breast tissue, all women have estrogen positive cell membranes because that's how we are managed. That's how our breasts are designed to respond to our cycling hormones. Um, it's the environment that disrupts and mismanages the immune system, and then the breast cell itself can become, um, uh, you might say, triggered or pushed into an environment where it responds with rapid growth. And then they use the advantage of the estrogen receptor, not causatively, that it can help to try and block the breast cell that has become cancerous from aggressively growing. That's the general thing and why. Now, myomin is also not as powerful as an anastrozole or a Arimidex or tamoxifen, and therefore it's much more gentle, and you can be taking it all the time. So that's probably why, Jennifer, they haven't brought that up as well. Um, the next question is from Carol. She says, "I know medical medium is controversial, but uh, he released a video saying that the immune system is not in the gut, but in the blood, that the probiotic industry promoted the gut." Carol, I'm going to say not so. I mean, even when I was a medical doctor in the anatomy lab, dissecting the real human being, we could see what was back then they used to call them Peyer patches, Peyer patches, Patches. And these are groups of the immune cells in clumps, and then other groupings of immune cells become lymph nodes and so forth. So, no, without a doubt, we saw the uh, surrounding of the gut, the largest concentration of clumps of immune cells is in the lining of the gut system. And it makes sense because the world comes to us aggressively in through our food, secondarily through breathing. So I disagree with that. And people want to click, they want to make money, they want to be famous, they want to be yada, yada, yada. Um, and I don't know all things, but I pray uh, because of my 45 years of experience that I had so much success in some of the most miraculous scenarios with the Alzheimer turnarounds, cardiovascular disease, and plaque turnarounds, and with polymyalgia rheumatica and other multiple sclerosis. I mean, I've had seen so much clinical improvement with the functional medicine approach that I've been involved in and did that second doctorate in to learn more back in 1999, 2000, and 2001. Um, this DIM, Doctor of Integrative Medicine, is the second doctorate I got. And I just know that I have seen this turnaround. Well, everyone wants to say they know. I'd rather let the patient know the whole gamut, saying, I am not the oncologist. I am not the surgeon. I'm not the endocrinologist. I am not the orthopedic. I'm not the gastroenterologist. I'm not the gynecologist. But my clinical experience looking at a whole system working from head to toe with all humanity, old, young, newborn, delivered babies, I get a feel for what has consistently been a benefit. And then I pray to God. I ask Him to lead me into truth. And so I think there's too many people nitpicking something to try and etch for themselves specialness. Now, we're all special, so you don't have to etch it. Just do good work, love your patients, be consistent, but don't say that there is no gut immune system lining the gastrointestinal system, because it definitely is there. Yes, the immune system is also in the blood. It's birthed these cells in the bone marrow, but the lymph nodes are very much involved in the whole system. So everything's interdependent. It always turns me back to the Bible when I think, if the eye thinks it's more important than the foot or the hand than the mouth or the nose for smelling or the ears for hearing. Look at we're all fulfilling a role that I believe God has given us to help one another. All right, so let's just try and help one another. And I tell you, God will give you enough money as a doctor to keep you fed and your family and a decent lifestyle instead of this uh, crazy amount of money that doctors are paid. It just produces um, not a good playing zone for why they are a doctor in humility. I think it breeds not good things. All right, so that's my answer there. Okay. Let's see. Beth says 13 months postpartum, taking Lexapro trazodone for anxiety and insomnia. And I'm hoping for a way to get off these medicines. Yeah, that was one of the ones I saw here. So I'll talk to that now. What would I do to suggest to get off of them? You're 34, thyroid, and you have Sjogren's syndrome. First of all, Beth, find a good doctor, a good functional doctor, and find out your blood type. That is going to begin uh, to early on help us understand you. Now, here's my experience. I'm not saying it's you necessarily, but A type blood, when I look at all the postpartum anxiety patients, or even not postpartum, if you can't digest your food well, then you can't get the phospholipids and the proteins, the fats to repair the lining of your cells. You can't digest your food well and extract the minerals that you need and the fats. And so you have a less well made brain, less well made nerves, less well made muscles. Everything's less well made. There's more little tiny holes throughout everywhere. This is how I see my patients. You know, how many holes do you have all throughout your body? And I got to help them to get them healthy. And so, like I saw in the picture, I have I had an IV started here 5 days ago. And I think for being 72 years old, it was all black and blue, real purple and dark, hot spot there. So within 5 days, I'm pretty well dissolving it. It just shows our body knows where to go and to heal. So I tell my patients with anxiety, depression, all of them, and Dr. Abram Hoffman, the father of orthomolecular medicine, was a psychiatrist. Um, he, along with many other forefathers in the functional medicine world, uh, along with looking at chemtrails and heavy metal toxins and pollutions and the cardiovascular saturated fat hypothesis of heart disease, all these people have found wonderful healing successes by adding dietary, nutritional resuscitation and guidance, maybe along with some prescription antidepressant and medicines that help one get rest. But what it turned out to be over the decades is doctors just keep refilling this rather than owning you as a person and a patient and saying, why are you still on these things? Are you still this in need of all your medications? And so we just recycle this drug culture. And it's harder to make money to sit here and only see 6, 8, 10 patients at most in a day and do a good job. I could make a lot more money seeing 40 patients a day like I used to on active duty. I would see 40 people a day, and I could generate all kinds of money, but I only could barely scratch the surface, and I had to zone in so quickly to the hot, most worst issue and protect the patient and do hopefully the standard of care as best as I could in the brief 7 minutes, 8 minutes I had with them. So here's what I would do. Find out your blood type. If you're an A, you definitely need the minerals and the B vitamins. You need the fats to calm all your nerves. that myelin sheath that lines for MS, for uh, Lou Gehrig's amyotrophic lateral sclerosis, Sjogren syndrome, autoimmune thyroiditis. All these things are injured cell membranes, and you have to calm your immune system down. Um, and so we would get the vitamin D level up to mood elevating levels at around 100, not be happy with the 30 to 60 range. We would get you up to 100 probably. We would check your liver enzymes and calcium levels. We would give you digestive enzymes if you're a blood type A. We would help you with your magnesium. In fact, we have magnesium IVs, but I put magnesium in my immune drip, my 25-gram vitamin C, which is very relaxing to the whole body. And so we could do some quick jumpstart, filling you up the tank with goodies that your immune system does with maybe some IVs. We can pull oxidative stress down with Juice Plus and with the antioxidants in my IV. Uh, Iodine is very important in cognitive focus and mood stability. We would do an iodine level, or we would just start giving you iodine. I'm almost at the point, 97% of all the people are iodine deficient. Why should I even have you pay the money to do the test to prove that you're iodine deficient? So I can't see any harm with our low iodine diet, from taking at least 12.5 milligrams, maybe 25 milligrams a day for a while, and follow up with your functional doctor on that. So there's many things we would do. We would look at your hormones. Remember, when you get pregnant, your estradiol can go from 30 to 30,000 nanograms, no, picograms per deciliter. 30,000. And then within 3, 4 days, it crashes down to the bottom, all the way down to 30. How would you like to do that as a man, and over having babies? Wow. I mean, having your hormones, which are vitality and mood and cognitive function and sleep help. The same with the progesterone. You can go from, like 4 to 44, okay, on the progesterone, and then it crashes within the first week of having the baby. I think doctors, not to mention thyroid, cortisol, dihydroepiandrosterone, DHEA, all these things really should be looked at by good gynecologists, OBGYNs. So that's what I give. I give DHEA. I start women on a little estradiol at nighttime to help them sleep, and I give them progesterone. And then they do much better with their nutrients and their IV and their Juice Plus and their D. These are the things that I would do. And then I would start taking away the sleep enhancers. And I would try and work with natural calming agents, maybe ashwagandha, melatonin, and trying to do that instead of trazodone, and giving you our clinician's preference oil, a double dose, 4 in the morning, 4 in the evening. These healthy fats help with the membranes. Oh, there's so many, many things. And every time I've done this, the woman has been much better. So hopefully that helps you, Beth. Okay, Barbara says, "Hi, Dr. Ellithorpe. Hi, Barbara back. I know you have talked about nicotine helping with long COVID. Yes, I've heard recently about nicotine patches helping avoid getting sick and other benefits. What say you?" Yeah, I think there's a building body of both anecdotal, clinical case study reports from licensed medical providers who are using from anywhere from 2 milligrams to about 6 milligrams of nicotine daily to get to our autonomic system. We have nicotinic receptors. They inhibit ACE receptor stimulation, and they block spike protein docking on these ACE receptor sites that are associated with it. So I like it. Now I have it as a lozenge. Here I get it from Walgreens. There's 4 milligram per little tablet in here, and I just stick it under my gum. a couple of times a week, usually because someone asked me about it. I've had this probably for 6 months and I haven't used up the bottle. Uh, there's gum. The gum's okay, but it will give you a burst of nicotine. Some of the effects on the autonomic nervous system, you might sense a flush, or you might get a little increase in your heart rate. Some people notice that they're very sensitive. So I think the gum might give you a too quick of a delivery. Um, but I can handle the gum. Of course, I used to be a smoker for many, many years in my teens and 20s until I had my first child. Then I had stopped for about 20 years. Then the stress of being a doctor, I went back to smoking. And then I finally got off of cigarettes, I would say about in my mid 50s. And then I learned about the e-cigarette, and they had the nicotine, and I used a very bland standard dose, not fancy flavors, until I could get back off of the e-cigarette. So we're all people with our stressors and our weaknesses. And so I'm familiar with the impact of nicotine, but some people can be very sensitive to it. Then the patch at the drugstore is, I think it comes as a 7, a 14, and a 21 milligram. That you don't need a prescription for this. You can go and get it yourself. Of all of these things, I like the little lozenges that you can stick under your tongue. 4 milligram, just let it sit in the buccal area here, and it will um, gradually dissolve and very slowly, and it shouldn't have too much impact. Now, you have to do many other things. You have to be low carb. You have to start exercising. You have to drink your good water. It should be filtered water, structured water. You need to do both resistance and aerobic exercise. That's what I'm going to do afterwards. I'm in my gym clothes right now. So when we're done, I'm off to the gym. And then you have to be on some nutrients. I'm definitely always going to support the greatest volume of research for whole body cellular health. I think is Juice Plus, hands down. There's nothing that approaches it. And I would credit Juice Plus with the entirety of the movement of showing that nutraceuticals can get excellent peer-reviewed, third-party, independent research on controlled and blinded studies that are randomized, and that's the highest gold standard. So it was Juice Plus that was the big brother that showed us that nutraceuticals can get the attention of doctors. So there you have it. All right. Plus, you have to have your D. So get a good functional doctor, and along with the nicotine, and that they have some knowledge. There are many doctors that talk about this, many neuroscientists now. So I think the one that originally promoted this was Dr. Ardis, Ardis. He's a chiropractor, but he did a very excellent job in educating people about this, including myself. So hopefully that helps. What's next here? Um, Carol says, my 74-year-old brother has been very lethargic. They found he has calcium in his thyroid and had to have one of the 4 thyroid sections excised. What causes this? Well, whenever there is a damaged part of the cell membrane, okay, wherever the cell membrane is damaged, okay, you can see right there, it has to get fixed to this area here. And the way to do that is to be living a simple, uninflamed, non-wild dietary lifestyle, low in carbs, plenteous in filtered water. Get the sunshine, get the strength training, get the aerobic, have good nighttime hygiene, going to bed, lights out, no electronics, and eating a simple diet. The most calming is to stop thyroid inflammation. And so nodules in the thyroid reflect that there was some inflammation at some point in the thyroid, most likely through the leaky gut that inflamed the body, that attacked through molecular mimicry the surface definition of the thyroid. The immune system mistook it for a foreigner and inflamed these areas. Then the body moves in with its natural healing to put a capsule, fibrin, put a block around the irritated tissue, and wall it off if it doesn't get healed. So these actions of the inflammatory response of healing is good in tiny areas, controlled, but when it's too long and too protracted, then the healing is said to be, we can't finish healing, it stays inflamed. And so the walling it off and putting cement like calcifications around it occur. There's those who argument will have an argument saying these chronic irritations will attract um, cell wall-less bacteria like mycoplasma or pneumococcal pneumoniae or mycoplasma. What else? So, there are other uh, non-cell wall type chronic low-grade infections that go to these irritated sites, and these bacteria want the calcium to kind of encapsulate their little house where they live, where the plaque on the artery. Because we have done testing, I think there were Finnish studies. I think these were done in the late 90s, and they've been reproduced where they took the plaque off of the coronary artery bypassed for blockages of the heart, and prior to that, when they've studied it, they would look for bacteria, culture it. Nothing grew, but fungi or these chronic low grade mycoplasma, because we've all had community pneumonias and we've all had some chronic viral uh, and even fungal and insidious infections in our life. And maybe we never truly get rid of them all, kind of like varicella, chickenpox lives in our dorsal spine of our ganglia of our spinal cord, and so they then said, let's culture this as if it's a fungus or a long tuberculosis type protracted infection slowly fungating. And in Denmark, they actually were able to see the mycoplasma grow. So they started treating arthritic knees and inflamed blood vessels with doxycycline and tetracycline, and they actually saw a dissolution, a kind of improvement, a diminishment of these calcification. So who's going to make money on this? There's no one drug. It's just doctors with good minds uh, trying to solve a problem worldwide. We're no better brains here in America. We have wonderful brains, but so do Denmark, so do Chinese, so do Australians, all over the world, Africa. Uh, it's when we have enough peace and civility that we can sit quietly and ponder a problem like, the cell membrane and the multiple venues that could generate problems to the healing response. And so, yeah, this may make a nodule in the anywhere in your body, whether it be the thyroid or other parts of your body. You can develop nodules, and maybe there's some component of this that's infectious. So that was a rabbit trail. Anyway, let's see, what else do I have? La, 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 la. Okay. Mara Siebert. All right, Miss Siebert says those are disgusting. What are disgusting? There is a pill. Okay. Well, anyway, I don't know what you're referring to, Marielle. Maybe some of those icky things I was talking about. But then my sister Debbie, hi Debbie, love you. She said, "Praise the Lord and thank you so much." Well, God is the one who's the author of this. I'm just a messenger. And then Kate DeSantis says, Target stores carry Nicoderm in their stores on the shelf. You can buy it right off the shelf. Yeah, yeah, it's over the counter. And I do hear, I don't know if it's conspiracy theories, but they say that nicotine is going to be taken off availability to the general public and made prescription in the next year or so. So I bought quite a few of these So there you have it. But I also bought quite a bit of ivermectin too and other things. There's Damien. Hi, Damien. Good to see you. Blessings. I am blessed, Damien. I have the best patients. I have the best job in the world, second to being a mother and a wife and a sister and a daughter. And yeah, I'm blessed. Uh, I took a capsule of sea kelp daily for iodine for 2 months, and I developed hives, itchiness on my neck, along with a rash. So I stopped it. Should I try iodoral? I would. God only knows what was in that capsule. See, we don't have the money to have the control and the testing for quality. And unfortunately, where did that kelp come from? Did it come from the waters that are in the Japanese and that Chinese Sea there with all that leakage of radiation from Fukushima? God only knows. Plus, what are the fillers and stuff? I know Dr. David Brownstein, Browstein, MD. He's a family practice doctor, similar to me. He did his focus on iodine research, and his work is voluminous. God bless him for it. So I'm not going to waste my time studying iodine. His work was so convincing and thorough. He wrote a book called Iodine by David Brownstein. And he has many videos on YouTube where you can save the time to read the book, and you can see his wonderful interviews with like Dr. Ken Berry and so forth. So even the YouTube and going on this YouTube digital area, the electronics that I so much despised, I can find the good parts to it. So look and listen to him, and I would say iodoral is just fine, just fine. Start with only one tablet and take it with food daily, and you should do fine on that. Okay, so now let me go to some of these questions here. Some of you have answered, I've answered it already. Okay, Josie. Josie says, I'm considering doing bulk amid, Bulkamid, for urinary stress incontinence. Josie asked this, do you recommend the surgery? Well, it's an outpatient surgery where in the exam room, the doctor will usually use a injection right at the little urethra area where you urinate from. So that's the most um, ventral or top little hole in the girl's anatomy. Then the next area opening is the vagina, and the last is the anus. And so if the hole is paper thin, and I've done this many, many times, as we get older, we don't have our hormones. And so the hole itself gets very thin like this, the skin lining the urethra. But maybe when you were younger, okay, I'll use a cloth now. Let me use my sweater here that I changed out of to do my gym work, my weightlifting. Here's let's say when you were younger, you had so much estrogen, the lining of your the hole there was much thicker. Do you get the drift of what I'm talking about? This thickness right here, the thickness versus the thinness of the lining when you're an older woman or man. So the lining of the tube gets thin like that, and what happens then is you can't close it with your muscles down there on your pelvic sling, and so you'll sneeze or you'll cough, and that bladder will have a little bit of urine through that thick thing, and it'll leak the pee right out onto your panties as you get older, as an older woman. So what do? I give estriol with testosterone vaginal cream, and I put that just right at the vaginal entrance every day for a week, and then 3 times a week thereafter. And most women get tremendous help from that. Plus, I put them on natural estradiol to help thicken that lining so it's more like the sweater, okay? Instead of a very, very, very thin, post-menopausal lining like that. I do not like injecting anything. I don't like hormones in the pellet form injected. They use acrylamides. There you go. polyacrylamides. Acrylamides are carcinogenic. And so, if your body can take that acrylamide and a little bits of it can turn carcinogenic, I just don't believe in putting in, implants in your body for anything. If you have to get a hip replacement, you have to get a hip or a knee replacement. If you have to have a disc surgery, you have to. But I don't think I would do this unless you try some of these natural things first. So, no, I'm not in favor of that surgery. Marcella said, Mary Ella is easier to say. There you go. Thank you for understanding my limitations. Okay. The next one is Mano. Mano says that they were vaccine injured 2 weeks after, in 1990. Apparently, they got a vaccine in 1990. And what is the remedy for a 36-year-old? So 1990, if you were born in 1990, that was probably your childhood vaccine. I guess your mom told you about that. Course of action. Well, Mano, it's too long for me to handle right here, but I would just say you have to find a functional doctor, integrative medicine. Call around, talk to the front office, find out how many years they've been doing it. Um, I mean, I had to start somewhere new too. I was a brand new doctor in 1978. So we all start somewhere. So I'm not saying if they're new at this, you can't see them. But if you can find a doctor that has decades worth and is already familiar with Susan Humphreys, Humpries, Suzanne Humphreys, MD. She wrote the book called Dissolving Illusions. Dissolving Illusions. Please read that book. There is a website. What's this website? It's called VACINFO, or it's VACinfo, VACINFO.org. And that's a place in Florida for getting information. We have the website I've used, and I have the dissolving information, dissolving illusions on Susan Humphreys, Dr. Humphreys' book. But I have another site that's very good to see. It's called childrenshealthdefense.org. CHILDRENS Health Defense, childrenshealthdefense.org. And that's with Dr. Del Bigtree has the high wire. He works in close association with Children's Health Defense. That was Dr. Kennedy's, he's not a doctor, Robert F. Kennedy Jr., the lawyer who's now our health secretary. That was his original group he worked with, childrenshealthdefense.org. Del Bigtree, thehighwire.com. These are great sources, and the lawyer, Dr. Aaron, he's not a doctor, Aaron Siri, Siri, Esquire. He's a lawyer who has won the defense against the CDC that they did not do the safety studies that they implied that they had for these things. Now, for treatment, so we have to do all these things that we would do for anything: long COVID, vaccine injury, postpartum depression. We look at your physiology, your sex, your blood type, your digestion. We do all these things to build you up into a stronger, healthier person. Let's see. What's the next one? Harvey. Hi, Dr. E. What do you think about kale? It seems people either promote it as a superfood or they criticize it for having phthalates and oxalates. Thank you. Yes, there are two camps. One is don't take it because it has these food anti-nutrient phytochemicals, and all plants, all raw food does, in various forms. And that is so the plant can fend off being consumed and destroyed by plant plagues and fungi and insects. Now, the argument is true, and taking these things is a challenge. And I would say to you, most Americans are injured already. So I'm not a plant pushing doctor because I'm already dealing with injured guts in all my patients in general, from genetic modification, from glyphosation, from heavy metals falling on it from the sky, all kinds of pollutions, fluorinated, chlorinated water, the stress, the electromagnetic energies. The doctor has to have enough time with you to try and help you work this through step by step. You can't solve it all in one visit or with one pill. So that's what we would start to do, is telling you to try and eat more like a carnivore and only eat cooked vegetables. That way you greatly reduce any of the damaging anti-nutrient phytochemicals that are contained in all plants. So I'm a proponent of protein and a cooked vegetable, salted and buttered up, and eat a humble diet, unless it's a true holiday, and then you have fun and you eat. But we've been trained and taught and duped into making every stupid day I deserve a treat today through commercials, and we're hurting ourselves. So yeah, plants have uh, uh, in them good uh, antioxidants. Plants have in them maybe some benefits of fiber. That's an arguable point. What you need to do is work with your doctor on your blood type, your age, your unique situations, but simply mostly a carnivore diet is going to probably jump you into a better stage right away, then adding in cooked vegetables and living a more modest life as you're studied and evaluated. I would probably evaluate with a complete digestive stool analysis that looks at all the poop and the digestive parts of it, and the uh, bacteria components, and the inflammatory markers. So you need a very good stool study with your blood type to begin to understand what you're dealing with your patient. The next question is, do you have an opinion on the topical use of dimethyl sulfoxide, DMSO, for relief of neck pain? Some information I'm reading says it's dangerous, but it works really well. Yeah, DMSO is a solvent, and it helps to deliver things through membranes. And so if you use it topically, you shouldn't use it long term. If you have damaging material on your skin, you're going to draw that toxin into your body too. I don't use it. I have used it in the past, in the 1990s, but I found there's other ways to help with neck pain, like systemic enzymes, hydration, magnesium, certain physical therapies, certain infrared light therapy, certain pulsed electromagnetic frequency therapies. So I have not needed it. Um, the next one, well, that was Carla. We covered your postpartum anxiety. So the next one, oh, Anna had a brother that had a detached retina, and they had surgery, and then a gas bubble. And then a few days later, AFib, got placed on blood thinners and heart meds. Then a week after that, he got pericarditis. Then he was in the hospital, and now he's out. And now he has the detached retina again in a different spot due to the scarring. And this was all triggered with elective cataract surgery that all this is. Well, your eyeball is a balloon of kind of like a gel liquid in here, and it keeps the eye expanded. So the membranes are expanded, like blowing up your mouth. Now, if you don't drink enough water, if you live a stressful life, oxidative stress, then what's going to happen is you are going to start having breakdown of your membranes, okay? Whether it's in your eye or in your lens, and that gets oxidized and turns into a scar, and then you can't see through that. Now, I just thank the good Lord that I don't have cataracts. My optometrist is kind of amazed that I'm 72 and I don't have these age-related changes showing up on my eye exam. So we thank the Lord. But I've been on Juice Plus for close to 30 years now, at least 27 years. It's the best antioxidant. I drink the water, I take my hormones, my general contractors, I get a good night's sleep. I get up with the sunshine, I put my little toes in the wet grass for 5 minutes, 3 minutes, most every morning. I get my little walk with the infrared in the morning. I'm going to be in the gym here in a few minutes doing my weightlifting 3 times a week for an hour. So all of these things work together to try and prevent breakdown of any cell membrane or situation in your body. Now, let's preserve everything else you have so you can help heal. Like I'm healing up from that where I had my IV and I blew it and I pulled the thing and the blood got under my skin. But praise the Lord, I'm healing up nicely within 5 days like a younger girl. Okay, what's the next one? Um, Barb says, I was diagnosed with hypothyroidism in 2010. I was taking Synthroid, which is T4, which is the precursor to the functional thyroid hormone called T3, okay? Triodo, 3 iodine molecules, thyronine. And this year, she wanted to be changed to Armor Thyroid, which has the whole T4, T3, T2 in it. She said, I'm confused about iodine. Should I be taking it now? I would say 97.3%, just like what David Brown found. All my patients are deficient. I was deficient. So my answer is yes. Her current doctor does not like supplements or has any knowledge of them. Well, probably they don't like them because they don't have knowledge. The more you realize you need them, the more you like them. I don't like taking my little bowl of vitamins every morning, but I know I need them to stay well and functional and work as hard as I do in my 70s. All right. Can you recommend a good brand? Yeah, Iodoral, Iodoral by Dr. David Brownstein. Orthomolecular makes I-Throid, I-Throid. So that's another good product by Orthomolecular, but you can't buy it unless you're a healthcare provider. They only sell it to us healthcare providers. And Hayden says, um, I eat my weight in protein. I also eat a couple of handfuls of spinach every day, raw. And I've just read about a concern with oxalates that come from things like spinach. Yeah. Anytime you do something marketed over and over and over and over and over and over, you're going to increase the likelihood of the potential negative effects of that food. So we teach, I have my meat and broccoli day. I have my chicken and green bean day. I have some salmon and asparagus day. I have some pork tenderloin and my Brussels sprouts day. And then, I have my omelet and maybe put some spinach in it with some cheese. So I try and eat a humble menu, and I eat the one menu for the whole day for any meal. But I'm a one meal a day person now. I'm trying to eat between 2 and 4 o'clock every day, and that's all I do. So all I have to worry about is one meal. But if I ate the same thing, I would eat it, at 9 or 10 or 11 or whatever. So a one meal day. Yeah. So, and that should be eaten every day. Also, I supplement with vitamin C. Once you reach 1 gram, it will convert to oxalates. Yes, theoretically, the biochemistry of vitamin C is yes, it can be metabolized into oxalic acid and oxalate crystals in your body. But look at, I have since I was 7 years old and saw my grandfather have unstable angina at rest. He was getting ischemic chest pain. And my father got him to the Great Lakes, GLACAM, Great Lakes Academy for the benefit for Academy of Medicine. Yeah. So, and that turned into ACAM, the American College for the Advancement of Medicine. So, my dad in the 1950s got my grandfather IV chelation therapy when it was still patented by Abbott. Abbott had the patent on EDTA chelation, and that was given with vitamin C. So, I'm 72. So, I have 65 years of experience of people getting high dose vitamin C and heavily in myself and in thousands upon patients with tens of thousands of IVs, and I don't see kidney stones. So that's my answer on that. Of course, I tell them to drink a lot of water. What did Hayden say? Okay, that was Hayden's question. Josie, what would you recommend Bulkamid for stress incontinence? My answer is no on that. Uh, Harvey says, hi, Dr. E. After 7 days with a sinus infection, I'm starting a course of azithromycin. Can you tell me the best way to preserve the gut microbiome, probiotics, yogurt? We have probiotic 225. Anytime I go on an antibiotic, I take a powdered packet of this once a day for 2 weeks. Then I drop down to the capsule. Orthomolecular makes it as probiotic 100, and I'll use up that bottle. And then I'll drop it down to my daily dose. I take probiotic. It's not the 100, just one standard one a day. That's how I would do it. Michael says, a good friend has a lingering cough. I've recommended high doses of vitamin C and silver, Argentine silver. Sovereign silver is something that you can get over the counter. It's called Argentine silver for physicians. We get a higher concentrate of it. Is there anything you'd add to the list? Thanks in advance. Well, any lingering cough needs to be seen by a doctor and get a chest x-ray and so forth. So if he's being managed by his doctor and they're checking with a chest x-ray and all things are otherwise well, I would try the antihistamine effect of quercetin in seasonal shield, or what is called DHIST, DHIST. And that quercetin at 600 milligrams a day tends to help as well. Iodine helps as a mucolytic agent. N-acetylcysteine, 500 milligrams twice a day, also helps with these cough, being well hydrated, low carb, and lifting the head of the bed up. Have them sleep in a recliner chair, and that tends to help. All right. And then Donna says, is it okay to give your body a break from all supplements for a week or two and then resume? Absolutely. Life happens. I've done that. And it is, I don't know if there's any real benefit or if there is a harm. I have been taking my nutrients, and all I can say is, since no one taught me, there wasn't a medical school allopathic medical degree that I could learn about these things, and the dietitians were wrong and my teaching professors were wrong. All I'm telling you is I now have 45 years of medical experience of the value of these nutraceuticals that I have clinically tested. And I look forward to it becoming more and more popular and more referenceable with research on these products. And hopefully they'll get a seal on them eventually saying this has been evaluated by the Better Business Bureau or the CDC or HHS and is authorized to have and follows good manufacturing activities for its nutrient content, lack of fillers or heavy metals. And then the next one says, Sharon says, what is the best way to detox from chemtrails? Oh my God, that's a long question. She's in Georgia and it's almost a daily occurrence. Everything I've said, do your EDTA chelation at least monthly or at least quarterly. Try and find a good doctor, acam.org, acam.org. Find a chelation doctor who can pull these toxins out of you. Use good supplements. I would be on Juice Plus, vitamin D, extra vitamin C orally, your methylated B complex. I would do that and go from there. Marilyn says, I listened to an alternative Canadian medical researcher, Dr. Thomas Janossy, Janossy. He recommends chelation for people over 50. Good. Especially because he says the hypothalamus is almost always calcified by that age, and it isn't protected by the blood-brain barrier. So it is particularly vulnerable to pathogens. Any comment? Well, I would start testing people certainly by age 12. I think a child is usually stable enough to do a 1 hour IV to get an EDTA chelation. If there's 80 pounds or more, that's like a petite woman, elderly woman, and we treat her as an adult with a standard measurement for heavy metals, and we start treating them earlier than that. That's what I would say. So I say bravo to that. So I realize I have gone way, way over today. And so I'm going to stop here. I have one more page with 4 questions or 5 that I haven't gotten to, but it is what it is, folks. Let's see. Emily here on the live chat says, do you have someone in your office who will manage my current bioidentical hormones? Yes. Regimen. Yes. I don't need a new integrative doctor, but the doctor who oversaw this aspect of my health has moved away. Yes, certainly. Our well, Dr. Mitchell, Dr. Gonzalez, and Dr. Uh, Lamb, our two physician assistants, are excellent at this. So, and hopefully that'll be a blessing to you. And then Carolyn says, your dad was so wise and progressive. Yes, I will say, yes, he was blessed of the Lord with what, and the most important thing is I got to see my father accept the Lord Jesus Christ and get baptized. As an adult woman, I saw my father bow the knee to the lordship of Jesus Christ in his life. And that was his greatest influence on me. My mother had always been doing that and reading the Bible. So I think that's the greatest gift. And it helped me use God also as another resource to lead me into all truth, even medical truth. So, and not put money or position ahead of anything. And so, to that sense, ladies and gentlemen, I'm going to end. I'm going to say, God bless you. And, just it's worth living well and helping others for whatever comes in the future. We need to be healthy to help our loved ones and our neighbors, no matter what their race or sex or age or political or religious beliefs. We are to be known as Christians by the love we have for one another. Yes, amen. All right, take care. Like and subscribe. Like and subscribe if this is a blessing. See you next time. Tuesday at 6 o'clock next week. Good night.